Good evening, viewers. Welcome to your number one health show, Health Zone on Bina TV. Our topic for this evening is flat foot, and I have with me here our favorite physiotherapist, Mr. Misbah Samir, CEO-Citi Physiotherapy Rehabilitation Center, Kaswa. Welcome once again to the show, Mr.
Thank you
Samir.
so much.
Oh, okay. So we are talking about flat foot.
Yeah.
Tell us, what is flat foot?
All right. When we say a flat foot, is um, is 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 those kind of foot that lose their arch, you know. So when we look at our feet or our feet, we realize that um, the inner part of it is a bit curved,
Yeah,
you know.
like under the
Under
foot.
the foot is a
Okay.
bit curved, but amongst some group of people realize that the inner part of their feet are not curved but rather flat.
Okay.
So just to give a bit of an illustration, I brought our friend here just to give an illustration. So if you look at the under of the feet or of these foot, you realize that there's supposed to be a curvature here, an arch here. That is how a normal foot will look like. But however, for people with flat feet or a flat foot, wouldn't have this curvature, wouldn't have this arch,
Okay,
but
straight.
rather
Like,
will be straight.
yeah.
Therefore, when the person puts the foot down, it's actually flat on the floor. Yes, so that's what a flat foot is.
Okay, so
Yes.
tell us what causes this condition or this
Yeah, okay.
situation?
All right. So many factors can be the cause of someone having a flat foot. Number one can be hereditary. For some people, they're just born with it like that. Uh-huh. The other the other reasons why someone will have a flat foot will be because of overweight.
Okay.
You know, sometimes too much of the weight on the body can actually collapse this arch and making it flat. And it can also occur in people who wear high heels.
Okay,
You
so
know,
let me get this straight. With the overweight thing,
yeah,
are you saying someone can initially have the arch under the foot,
yeah,
like have a normal one,
yeah,
and then when the person begins to gain weight, the foot will gradually flatten?
exactly, yeah,
Okay, wanted
exactly.
to get that straight.
Because when the person's weight become more, and there's a lot of pressure on the foot, the ligament and the tendons in the foot that actually supports the arch tends to collapse,
Okay.
and that particular person will have a flat foot.
Okay.
Yes. So the other cause will be actually wear high heel because of the position when you high heel. Yes. Another could be as a result of accident or as a result
Okay.
of an injury. You know, an accident or an injury can be a reason why somebody will get a flat foot. Then also, flat foot can also occur among people who stand a lot. You know, maybe their job would demand that they need to stand for a long period of time.
Yeah.
So these, among others, are some of the causes of what you call it, of flat foot. Yes,
Okay.
yes.
So what are the effects?
Effect at all. They might not even feel it or they might not even
They
realize
will be
it. Yes,
just fine.
they'll just be fine and they'll go about their normal activities without much problems or pain. But for some people, to later in life, it can actually affect them. But there are some people also, the moment they begin to have flat foot, they begin to have problems with their feet. They begin to feel pain,
Okay.
sometimes at the Achilles
Achilles
tendon
tendon.
area.
Achilles tendon, for the benefit of our viewers, is um, the the back of the leg.
So the
The
tendon that
heel.
actually the
The
heel,
heel, yeah,
exactly,
the
the
heel
tendon,
area.
yeah,
That's the Achilles
exactly the
tendon.
tendon that connects, yeah, the heel area, exactly. And some people might also develop pain time. And another group of people also, you might have I talk about tiredness of the feet when they stand for a long period of time. So these are some of the effects. And also the ankle joint itself can actually be painful, because now this is what happens when someone has a flat foot. Once it's flat, then you have the, what do you call it, the tibia internally rotating. So once you have it flat, this one will also internally rotated. So there will be a lot of pressure on the ligaments and tendons around the ankle joints. So you might have some group of the tendons actually overstretching, some also become less stretching. So the joint might not be in a proper alignment. So you have all those ligaments being painful, or the joint itself might start to rub against each other, and sometimes some arthritis might actually develop within the joint itself, in addition to all the issues that might happen to the feet as well. Now the other thing that I don't want to also forget is that there is also a phenomenon of the foot, also called the bunion. The bunion also occur when the big toe. So see, when someone has a flat foot, you see the big toe might actually curve this way, because the feet is this way, and you have the big toe actually curving this way. So you realize that the big toe is shifted away towards the lateral area. So for example, just to give a proper illustration, so this is the big toe, and you have it actually shifting this way because the foot is flat, and there's pressure this way. Once you put it on it, it put a pressure on the big toe.
So the big toe curves inwards.
The big toe curves inwards, goes towards those other toes. Okay. And once it curves those inwards, you might have the joint of the toes also becoming painful because of the pressure on it. Some people would develop bunion, might not necessarily be because of us. And the flat foot will bring about a malalignment of, what do you call it, of these joints. So what will happen is that this one will internally rotate, then at the same time you will have actually the knee joints also, what do you call it, moving laterally.
So they get their fair share of the problem.
They get the fair share of the flat foot. Might also experience pain, what do you call it, just at the patella area, in addition to pain at the generalized knee areas as well.
With this illustration, my next question comes in. Is it likely to go a long way to affect the spine too?
Sure. So just the illustrations I gave for if you have a building and the foundation is not properly placed, then whatever that happens at the top will not also be properly placed. So once you have this one also moving laterally, you also have the hip joint also, what do you call it, internally. Once the hip joint also internally rotated, you have all the ligament and the joint and all the muscles around here also being overstretched, and you also have, what you call it, pain developing at the hip joints. So you have knee pain, and you also develop what you call it, hip joint pain, and also, and you see these muscles are also connected to, what you call it, the spine. They are connected to the spine. So one of the consequences of that is that there's what we call a pelvic tilt. So there will be an anterior pelvic tilt, because this one is internally rotated. This one cannot be stable. So the pelvic will anteriorly tilt. When I say the pelvic will anteriorly tilt, this one will move forward. I don't know how to show it to you. I wanted to stand up and demonstrate, but I don't want to stand up and demonstrate.
You can lift.
Okay. Yes, exactly. So
towards the camera.
Sure. Okay. Great. So I'm just taking this one, so you can see that this one will internally, there will be anterior rotation of the pelvis. Yes.
It rotates to the front.
It rotates to the front.
Okay.
Yes. It rotates to the front.
Okay.
So anterior rotation is like when it rotates to the front. So you realize that there will be a what you call a flat back.
Yeah,
once you have an anterior rotation of the pelvis, then there will be what you call a reduction of the lumbar lordosis, so that the back muscles where the back spine will be flat, and there will be a lot of tension of the back as well.
Just by having flat foot,
Yes.
you end up having an ankle problem.
Yes.
A knee problem.
Oh, my friend is not standing properly.
And a spinal problem.
Yeah.
That's very interesting. It's like affecting the whole.
Sure.
The whole body.
So that is right. Or when somebody has knee pain, or when somebody has hip pain, they will do all kinds of treatments. They will go for treatment for years, you know, and the pain will not go away. If you don't have a good therapist or a doctor who knows his job properly and can be able to analyze and be able to trace it and see that, okay, the origin of the back pain could be because of the position of the foot, the fact that the foot is flat and therefore affecting the knee and the hip and the back, you can do treatment for years and your pain will still be there because the causative factor is there. Because this one is flat, this one is, you know, so it changes the frame of the body. The frame of the body, it changes such that you have a lot of tension in areas of the body that will eventually cause you to have pain.
In fact, what I find interesting is actually the fact that you mentioned that there are people who may be born with a normal foot, and then they grow, they gain weight, and then they end up having a flat foot.
Yes.
Because of the weight gain.
Because of the weight gain, yes.
Okay, so is the condition reversible?
Yes. So we manage it. There could be maybe a time.
If even I grew up, I had a normal foot, I grew up, I gained weight, and it became flat.
Yeah.
Can it be reversed?
Yes. So it's a yes and no. It's not. I wouldn't say what we say is that we manage it. Okay. We manage it. Maybe there will be a tiny minority that will regain their what do you call it? The arch back.
Get it back to normalcy.
To normalcy. But then for majority, you have to actually manage it, and there's actually a way of actually managing it. In order for you to regain the what do you call it, the strength. So I wouldn't like to give a concrete answer to say that we can actually bring back but you can manage it, you know. Exactly. You can manage it such that there are things you can do to maintain the arch, so that at least you can actually regain your balance. Yes.
Okay, so tell me, what are the challenges involved in dealing with issues of the flat foot?
Yeah,
as a physiotherapist.
Yeah, the challenge is, number one, is that I think it has to do with for therapists and even for doctors in general. Once the patient presents himself to you, and let's say someone comes with a low back pain, but then he doesn't even have an ankle pain, a foot pain, you know, we have to actually do a complete examination of the person to be able to trace back the root of what you call it, the pain. So many things can be the cause of can cause back pain, but then you have to be able to trace back. Maybe one of the possibilities could be the fact that it could be a flat foot. So the challenges has to be with therapists, doctors, and all of us actually have to get trained, you know, in this area. Then that's number one challenge. Number two challenge is that the people whose job is it to look at people's feet are called podiatrists, you know. And in the country, we have very few podiatrists in the system. You know, they are, I don't know of much in Ghana here. So what it means is that majority of people who have flat foot issues will not have a specialist whose job it is to look at the foot, or who could quickly be able to point out that, hey, you have a flat foot, and your flat foot can be the reason why you're having this knee pain, this hip pain, and that pain.
Yeah,
exactly.
It's quite interesting because in our settings, there are a lot of people who have feet like this. They have flat foot, and nobody even sees it as a problem.
As a problem,
so this discussion is actually enlightening. And so my guests, my viewers, if you didn't know, it actually causes major problems to the body.
Yeah.
Our physiotherapist is telling us flat foot is not supposed to be normal. The normal one should have an arc.
Yeah.
So when it gets flat, it comes with a lot of challenges.
Yeah.
Okay. So
yeah. So continue with the challenges with how we also, like with regards to people who have flat foot, is that is of course, and one of the ways we can actually manage it is what we use what, an insole.
Okay, I'll get to the management. Okay, viewers, if you just joined us, we've been discussing flat foot with physiotherapist Misbah Samir, CEO-Citi Physiotherapy
And
Rehabilitation Center, Kaswa. You can always pass by that place with your issues on physiotherapy.
And we are in Kaswa, right opposite UMB Bank on the main road.
Yes, so we've been discussing flat foot. So let's continue. Can this condition affect children, or does it affect children?
Yes, so as I mentioned earlier on, it could be hereditary as well. So some people are just born with it like that. So yes, that's how it can affect children. So once you have a child and the child has got a flat foot, kindly send him to a health worker, a doctor, a physiotherapist, for the child to actually be assessed.
Okay.
You know, to be assessed, so that maybe an early intervention can help to actually bring the arch back, or start managing the child from there before he begins to develop other complications. Yes.
Okay, so now I'll come back to the line of management.
Yes,
I wanted to mention it before, and I told you we'd get there.
Yeah.
So how do you manage the flat?
Yes. So in managing flat foot, there's so many things that can be done to manage flat foot. But chief among them is to employ the use of what we call insoles. You know, sometimes when we buy shoes, especially the sneakers, realize that we have these things inside that mimics that looks like the arch of our foot.
Okay, that's soft.
That's soft thing in it. Yeah. And sometimes when you buy shoes and there are sections. Sometimes when you go to supermarket, there are sections where you can just go and just buy just the insoles. You know, there's sometimes some people where you can actually just be able to buy the insoles. But you see, to manage it better, there is what we call doing the customized insole, so that they will place your feet in something, so that your foot will take the shape of the insole. Then they will design it for you. So this is customized for you. This will like really fit you. So if you have a flat foot, then you can actually be able to they can design it such that they reform your arch, so that your arch is placed properly.
So the idea is that gradually your leg will take the shape.
Exactly, gradually your leg will take the shape of the arch. Okay. So that is one way of solving it. And there are also exercises we can do. Simple exercises that when you see your physiotherapist or you see your podiatrist, we can be able to teach you in order to strengthen those group of muscles that are helping to maintain your arch. You know, the arch of your foot. So there are exercises we can do. There are some what they call devices that we can also use, some assistive devices or support that we can actually use to also maintain your arch. In addition to that, there is what we call kinesiotaping. You can actually find a way of taping the arch in order to either maintain the arch, so that you actually don't get it actually being flattened.
So yes, it is taped and it remains like that.
Exactly.
So like it forces you not to flatten it.
Not flatten it. Yes, exactly. And in some cases where we think some tendons are loose, you know, where if there are foot surgeons as well. Those surgeons, they can look at it, and if they think there's a way of actually readjusting some tendons, then you can also go in and do surgery.
Do we have foot surgeons here
in Ghana here? That we have orthopedic surgeons, we have general surgeons. So they might
be able to help.
They might be able to. I think some of them might also be specialized in foot surgery. Areas. I cannot say a yes or no. So some of them can actually help with that. But of course, it's better sometimes to do the conservative treatments first.
Yes,
When it's
before you
the
can do
last
it.
resort will be, even when you go to the surgeons, they will say, okay, try this, try this, try
If
this.
it
If those
doesn't
things
work
doesn't
out,
work, then maybe
then
they
you
will,
come
they
back.
exactly, yeah. But it's not in all cases that they will say they want to do maybe surgery or anything like that. Yes,
Oh,
exactly,
okay.
yeah. Yeah.
So jama with the chenga fira mu de ya daddy muna batun flat foot ne. Physiotherapist mu yazo Misbah Samir yana aiki. Shine CEO in City Physiotherapy Rehabilitation Center daga kasuwa. Physiotherapy and Rehabilitation
Medication
Center
center, yeah.
daga kasuwa yana around Pink FM na.
Yeah.
Muna batun flat foot. Wadansu na da kafa da karkashin kafan su na da flat. Wai ya kamata akwai rami. Ya muna fira for quite a while ina so ya kuma sake yi Hausa kadan ya so mutanen mu da bamu samu turanci ba mu understand Hausa na isa wai flat foot. Please tell us about flat foot.
To jama'a assalamu alaikum wa rahmatullahi wa barakatuh. Yau dai muna firan da muke yi ne muna firan flat foot. Aka ce flat foot, wani abu ne flat foot? Flat foot ne to ga wani abokinmu nan ganga dai dan dokin da shi kwatance. Aka ce flat foot, kagan Allah ya yi karkashin kafanmu aka. Amma ka duba karkashin kafanmu ta cikin nan gangan ka gani kamar akwai wani rami kasa nan. Ramin da ke kasan nan normally ya kamata mutum duka kana da wannan rami, amma akwai waɗansu kuma su ka gani ka duba kafansu ba ka gani wannan ramin nan. Shi yasa dai wani bai da wannan ramin nan kasan na kwance flat kan kasa in ya saya ma ba ka gani ba ka ya gan ramin nan, shi ake ce ma flat foot. Inda mai shi na da shi flat foot. To question ne to abin ga inda waɗanda ke da irin wanga flat foot ganga ya yake affecting su.
Akwai matsaloli.
Akwai exactly wani matsaloli yana da matsaloli, akwai wani yana da shi bai affecting shi bai damun shi, amma akwai wani kuma yana da shi kuma ya bari joint ya ke kiran shi ma ne
joint
ankle joint
inda kasusuwan ke ga
ankle joint shi ya yi mai ya sunan shi ya yi fara yana mai ciwo, ko kuwa kasan ganga kuma kashin ganga kuma ana kiran shi calcaneus bone, you know, da shi ya yi karkashin kafa na ya yi fara samu yana ciwo domin akwai waɗansu ligament da ke hold jointing na inda kafan nan bai samu ya zauna da kyau na yana bai bashi alignment, you know, ya bari bai bari yayi daidai
wurin nan na ciwo. Yasa so da yawa muna mu samu ciwon wurin kafan naka da wurin gwiwa da duka problem ne kafan nan na da flatten shi ke causing.
Shi yasa banda kamar ya samu ciwo daga ankle joint ya samu ciwo kuma cikin gwiwan shi, domin aka ce kamar in kana da gida inda foundation ya saya da kyau to bisan ya saya da kyau, amma inda foundation bai saya da kyau ba abin ya affect bisa. Shi san dai mai shi na da flat foot tankan foundation bai saya da kyau ba kenan ya zo yana affect gwiwan mai shi, ya zo affect hip mai shi, har ya zo yana affect ma bayan mai shi. Shi yasa sometimes kaga kamar wani yana da ciwon ba yayi te abin bai ciwon bai bari ba, ko ciwon ya bari ma shi ko mai komo. Ya kamata da examine mai shi a duba da mai shi in totality, a koma duba ko yana da flat foot. Inda yana da flat foot ne maybe ya kai wani correction kadan karkashin flat foot na ya ba body nan alignment, so ciwon da ke cikin gwiwa da hip da bayan nan duka ya samu ya rage.
Okay, mun gode yasa Misbah Samir ya gwada muna abinda flat foot ke yi cause. Yasa so da yawa wani abu ne da ba mu sa hankalin mu kai. Ni flat foot dan na ganin mutane da yawa na da shi. In fact na san wani da me shi na suffer problem gwiwa da kafan da bayan for so many years. Me shi kuma na da flat foot. But you see, don ba mu sani ba ne yasa a lot of people don't know. The person doesn't know kaman wani problem haka nan na iya yana cause. So me shi ya saura yana treat abubuwa ita shan painkillers
daban-daban.
In the end wannan kuma zai cause wani problem daban. Yes, so we should try to find out the cause of our pain and the source of the pain before we end up abusing all the painkillers in the world and end up getting liver problems and
all those kind of problems.
all those kind of things. Thank you very much. What is your final advice and recommendations you would give our viewers generally as a physiotherapist as far as fast food is concerned?
Yeah, she's our final advice in the naked machine. In the kaya kaduba, kana zone, kana gym program, kaduba kafanka kaduba. Okay, na the flat foot, go the flat foot. You can realize kana the flat foot. Oh, okay, na the ciwon gwiwa, na da ciwon baya, abin ganga aka ka sheka try, in ma ka try kai ka relate ko maybe it's with the flat foot ko ba. Amma of course, ke ba ka gane completely. Shi yasa ko da ka je gaban doctor ka ko flat foot, you know. But as I said, there are people who have flat foot and they don't have problems.
Have any problem
but then if you look at your flat foot, you say, oh, okay, I have ankle pain, I have knee pain, I have so you probably there's a problem. So you can see your doctor, you can see your therapist, point it out, because it's not everything that the therapists, doctors, they're also human beings. It's not everything that they will be able to see. So sometimes you, the patient, also need to point it out. Exactly. Oh, okay, I think maybe I'll have this one or I'll have this one, so that it will come to the attention of the doctor. Then he will send you to the right people, the physiotherapists, the podiatrists, you know, so that they can also see how they can manage and help you to actually take care of your condition. Yes.
Thank you very much for joining us.
Thank you so much too.
Physiotherapist Misbah Samir.
Yeah.
CEO-Citi Physiotherapy and Rehabilitation Center, Kasua, around Pink FM. Thank you so much, viewers, for joining us. We've been discussing flat foot and we've had a very interesting conversation. Thank you so much. Join us same time next week at 4 p.m. on HealthZone, Baina TV. Assalamu alaikum.
Alex,